Hello everyone, how are you all? Welcome to Dr. Rohini's Sthree, a channel dedicated to women's health. Today I've come back to you with a new topic for discussion, that is PCOD, that is polycystic ovarian syndrome. So I'm sure you all have heard somewhere a little bit at least about this health condition. So this is a health condition which has actually become very common in the girls of this generation. Let us first try to understand what is this. It is an endocrine disorder, that is a condition which is caused because of hormonal imbalance. It is seen in almost 10 to 15% of the girls or women of reproductive age. It means if you take 100 women, out of 100 women, in at least 10 to 15 girls or women, you can see this health condition. So it has become so common. So when do we say a girl or a woman has polycystic ovarian syndrome, that is PCOD? There are three criteria to diagnose PCOD. So according to ROTTERDAM's criteria, criteria number one is anovulation or oligoovulation. That is, if you get periods once in 35 days or 38 days is considered as normal. If your periods are once in 45 days or once in 2 months or once in 3 months, and sometimes even some women don't even get periods till they take some medications to get the periods. So this is called as anovulation or oligoovulation. Number two is hyperandrogenism. That is a condition in which the hormone called as androgen or testosterone hormone is high in a woman's body. So what are the changes which happens due to this hyperandrogenism is, number one is acne. So acne, having excessive pimples, more than 10 to 15 pimples on your face, or it can be on your neck, or it can be on your upper back. So this is having pimples in a young age is actually normal, but if these pimples or acne is resistant to any kind of treatment or oral antibiotics, if it is not responding to this kind of medications, then it is a severe kind. So if a girl has this kind of acne, or the other thing is hirsutism. So hirsutism is excessive growth of hair on a female's body in a male pattern. Like she can have excessive hair growth on the upper lip or on her chin, maybe on her hands or legs. If she has excessive hair growth, we call it as hirsutism. Or there can be male pattern baldness. That is, so the baldness which happens in a male is because of the testosterone effect of the hormone called as testosterone. So when this testosterone hormones increases in a woman's body, so that also causes the same kind of baldness. So she can have either excessive hair loss or alopecia. So if any of these symptoms of excessive androgen hormones in the body are noted, then we do a blood test, the testosterone levels, and that confirms whether she has hyperandrogenism or not. So this is second criteria. So the third criteria is the ultrasound findings of a ovary. When we do an ultrasound, the changes, the polycystic changes we see in a ovary. In a normal ovary, you can see maybe 5 to 6 or 7 to 8 follicles when you do an ultrasound. But in a woman with polycystic ovarian syndrome, you see small follicles ranging between 2 to 9 millimeter in diameter. If she has more than 12 follicles in any of the ovaries, then we call it as polycystic ovary. So in a woman, in a middle-aged woman, reproductive age woman, if it is if any of these two criteria are present, it can be either irregular periods with ultrasound features of polycystic ovary or irregular periods with features of hyperandrogenism. Any of these two features, we confirm that she has polycystic ovarian syndrome. But in a teenage girl, so the changes of these hormones happens in her body only when she attains menarche. So it takes few years for the ovaries to show those polycystic ovarian changes. So in a teenage girl, she should have all these three criteria to say that she has polycystic ovarian syndrome. This is how we diagnose polycystic ovarian syndrome. So you should get a doubt whenever your daughter has irregular periods, or if she has signs of hyperandrogenism, that is excessive acne or excessive hair growth on her face, or excessive hair loss, male pattern baldness. So if she has any of these features, you should get a doubt that she might be having polycystic ovarian syndrome. Also, another symptom which you can notice is, we call it as acanthosis nigricans. That is the thickness and hyperpigmentation in the nape of the neck. It could be because of, it is because of hyperinsulinism, that is insulin resistance, excessive insulin hormone in the body, which happens when there is obesity. So if you have any of these features, then we should get a doubt that there may be a chance of having polycystic ovarian syndrome, and that is when you approach a doctor. So why it is important to know about the polycystic ovarian syndrome is, the polycystic ovarian syndrome, it not only affects periods in a girl, so it has many other implications and lifelong long-term implications on a woman's health. It can affect her cardiovascular system. It can increase the risk of diabetes. It can increase the risk of endometrial hyperplasia or endometrial cancer. So it is not a simple condition as most of us think. It has got its own long term implications other than just periods. So it's very important to know more about this serious health condition. So I think for today this is enough. In my next video I'm going to tell you in detail what are the causes for polycystic ovarian syndrome. Till then, take care. Bye. If you like these videos, please like, comment and share. And for more updates on women's health, please subscribe to my channel and don't forget to press the notification bell.